Good afternoon. So for our DBH 9010 class, we were instructed to complete a provider education presentation. I chose mine on ketamine and behavioral health, talking about indications, the benefits, risk, as well as collaborative care. So the roadmap that I chose to take on this is, as far as my agenda is concerned, is clinical indications and the behavioral health intersection of ketamine, key benefits of ketamine, the route of use, particularly in terms of how this medication is administered, risk adverse side effects, clinical red flags, also psychosocial interventions, as well as non medication interventions, and also determining who are the appropriate candidates for ketamine and also what does monitoring look like in terms and as well as behavioral health follow-up. Research has shown that ketamine has been effective in regards to treatment-resistant depression, also severe major depressive episodes, and acute suicidal ideation as well. It's really been a powerful path to healing depression, anxiety, and PTSD. Evidence also supports potential benefits, particularly individuals who are struggling with the grips of addiction, so substance use disorder, and other psychiatric conditions. The other benefit of ketamine is that there is rapid symptom relief, so it does provide stabilization. It also enhances engagement so that clients can utilize psychotherapy feeling more grounded. Other key benefits to ketamine is that it is rapid, it is quick antidepressant effects within hours to days. It also helps to reduce suicidal ideation, sometimes independent of mood improvement. Also, it may enhance neuroplasticity, which one can engage in terms of doing deeper therapeutic work. So let's talk a little bit about the route of use in terms of how this medication is administered. So there's intravenous use, which is the most common use. It's widely used, but still off-label and not FDA approved. Then you have nasal spray, Spravato, which is now commonly used as well, and it's the only FDA approved formulation. You have intramuscular, which is used in some clinics, but not FDA approved. And then you have the oral tablet or the lozenger, which has a slower onset, still not FDA approved. So behavioral health providers often can help patients really navigate this and understand how IV ketamine is evidence supported but off label, while the intranasal Spravato is evidence supported and FDA approved. Why does FDA, and I thought it was important to kind of note this in my presentation, is why does FDA approval matter clinically? Because it does really determine insurance coverage. This is a very expensive treatment. Also, monitoring requirements. It also influences risk benefits discussions. It also shapes collaborative care planning, and it also impacts documentation as well. So there are some side effects and clinical red flags to watch for in terms of ketamine use. And I classify them in three. One is common side effects, the other one is serious, and the other one is red flag, which indicates a higher risk. So for common, we see dizziness, some GI upset, some nausea, some headaches. Also, it may elevate blood pressure as well. It does cause clients to feel, patients to feel tired, and also blurry vision as well. More serious concerns around side effects are some cognitive challenges, urinary or bladder toxicity, and the potential for misuse as well. Um, on in terms of high risk, there's uncontrolled hypertension, psychosis, active substance use or misuse due to the potential for abuse. Also, concerns around its use with individuals who are pregnant and also in regards to unstable medical conditions. So let's explore psychosocial as well as non-medication interventions. So before and alongside ketamine, we have CBT, ACT, which stands for acceptance commitment therapy, as well as dialectical behavior therapy skills, behavior activation as well, motivational interviewing, um, ensuring good sleep hygiene, and structured routines. In regards to post-treatment psychotherapy sessions, is really to help patients organize insight and translate them into actionable changes. In regards to determining who is going to be an appropriate candidate for ketamine, is important to kind of confirm the diagnosis, the severity of their symptoms, um, and also looking at inadequate responses to prior treatment options that the client or the patient has utilized. Also, screening to assess risk factors such as cardiovascular risk, substance use, urinary symptoms, and drug interactions as well. And then also I want to add is assessing for psychosocial stability, so what their support system's like, and the ability to really adhere or comply to treatment, particularly around safety monitoring. So let's look at monitoring and behavioral health follow-up. So behavioral health providers are instrumental in safety planning, symptom tracking, relapse prevention, and also the integration of therapeutic insights. And so for monitoring behavioral health follow-up, there are three categories to look at. There is the pre-treatment, during treatment, and after treatment. So in the pre-treatment, we're looking at taking vital signs, looking at mental status, any substance use review, and then also medication interactions. During treatment is monitoring for disassociation, changes in blood pressure, or any type of perceptual changes. And then after treatment is looking at reassessing suicidality as well as cognition, functional status, and also ensuring safe recovery. The benefits of collaborative care is that there is shared documentation of responses, is the review of side effects or any safety concerns. Also, there's clear protocol for hypertensive responsive, disassociation, or suicidality. Also, the integration of psychotherapy, lifestyle interventions, and substance use disorder supports, and also awareness of psychopharm dynamics, interactions with antidepressants and mood stabilizers. In short, some of the key takeaway for providers is that ketamine is evidence supported. However, only the intranasal route is FDA approved. Also, the benefits that it does, there is quick response to treatment, and also is a full understanding of the risks and red flags. The psychosocial interventions that are utilized to help serve as an adjunct to treatment, and also looking at candidates who are appropriate for ketamine treatment. Also, monitoring to ensure patient safety, and also the opportunity for collaborative care. My final thoughts is that there has been so much controversy on the use of ketamine. And so I was glad to kind of do a deeper research into ketamine and realize that it also has increased my own insight and awareness, also has made me feel more comfortable and at ease in regards to providing education to my clients on whether or not this could be a benefit to treatment, especially if they're not responding to other treatment options.